I wanted to know that I've been trying to conceive for quite some time now, but then I've tracked down that I get my periods on time, the flow is good, everything is fine. I even track my ovulation, everything goes well. But then, what is the reason that I'm not still conceiving yet?
Okay. So since everything as per what you say is good, we would have to run a few fertility tests for you and your husband to understand where the problem is lying. Hello everyone. So today we should delve into the realm of fertility testing. So if you are someone who's been trying to conceive for a while, or you are someone who's simply trying to understand more about their reproductive health, these tests can provide you crucial information about your overall fertility. Also, fertility is not only a woman's problem but also a man's problem. So we will talk about tests that both men and women can run when they are on their journey towards conception. And if you are new here, hi, I am Dr. Zainab Tajir. I am a homeopathy consultant and psychological counselor. I help women balance their hormones and help couples conceive naturally through homeopathy and holistic lifestyle changes. So if you enjoy content like this, please don't forget to subscribe to my channel. So let's start with some of the most basic testing. The most basic test that we usually run for women is hormonal tests. Our menstrual cycle is primarily an interplay of four hormones: FSH, LH, estrogen and progesterone. So understanding if all of these hormones are in the right balance can really help you understand a lot more about your fertility. So we usually run serum FSH, LH, estrogen and progesterone test on day 2 or day 3 of the periods. This really helps us understand if the baseline tests are normal. Now, if you actually ask me from my experience, does having a hormonal report of baseline absolutely normal mean that the woman has no fertility related concern or hormonal imbalance? Well, definitely not. So hormonal imbalance is something that is clinically diagnosed instead of something that we rely on primarily through investigations. So simply having good baseline tests does not mean that you do not have any hormonal issues. Therefore, it's equally important for you to speak to your doctor regarding this. Now, the second most important testing that we do is ovulation testing. When trying to conceive, a woman is only fertile for 3 to 5 days before ovulation and on the day of ovulation. So it becomes very important for us to understand whether the woman is ovulating properly in every cycle. One of the tests that we run for that is a serum progesterone test, which is done on day 21 of the period. Now, it is day 21 when a woman has a regular 28 to 30 day cycle. But let's say you are someone who has irregular periods. In that case, we run serum progesterone test 7 days after expected ovulation. A rise in serum progesterone helps us conclude that the woman has ovulated in that particular cycle. Secondly, we can also understand whether a woman is ovulating through over-the-counter ovulation prediction kits. So using these kits can also help you understand a lot more about your fertility. Getting a positive on these LH strips can help us understand when again a woman has ovulatory cycles or not. And thirdly, there is an ultrasound called as a follicular study that is done. Now, in the follicular study, we do consecutive ultrasounds to understand if one, there is a good follicle growth in the ovary and either of the ovary has a dominant follicle that ruptures. And we also try to understand if a woman has good endometrial thickness, which she develops during ovulation so that the implantation can happen successfully. So running these tests can help us understand whether a woman has ovulatory or anovulatory cycle. The third important test is an ultrasound imaging. So doing a transvaginal ultrasound can again help us understand whether everything is anatomically good in terms of the uterus, cervix, ovaries, etc. or a woman has conditions like fibroids, polyps, PCOS, endometriosis, etc. So in order to rule out these pathologies, it's important for you to run an ultrasound. Now let's say a woman has all of these tests that are normal and they are still trying to conceive for 6 months or more and are unable to conceive. The next investigation that we usually run is a hysterosalpingography. So a hysterosalpingography is an X-ray procedure where a dye is introduced within the cervix and the uterus to check for the patency of the uterus and the fallopian tubes. So this helps us understand whether there are any abnormal blockages that are present within the tract of the uterus and fallopian tubes, which would then need some form of correction. So this is also another important test that is usually run. It's very important for us to understand whether a woman has a good ovarian reserve, and one way to do that is to run a serum AMH test. A serum AMH test helps us conclude whether a woman is in a reproductive stage or is already heading towards premenopause or has a premature ovarian failure. Secondly, we also can do the AFC test, where we do an ultrasound on the day 2 of the cycle to check for the number of antral follicle count which is present, and this again helps us get some form of idea about a woman's fertility. Now, if there is a couple who's had recurrent miscarriages or they are finding extreme difficulty in conception, in that case genetic testing is recommended. So we run genetic and chromosomal testing on both the man and the woman to conclude if there are any chromosomal abnormalities that are contributing to the couple unable to conceive or having recurrent miscarriages. And the last test that we recommend, which is usually a last resort, is a diagnostic laparoscopy. Now, when a laparoscope is introduced within the uterus and the tubes, it helps us get a visualization of the internal structures and understand whether there are any pathological problems or adhesions or scar tissue developments that are existing in this particular case or not, and accordingly understand if there are any other factors that are probably contributing to this couple unable to conceive. Also, let's talk about the tests that are necessary for men to run. One of the most basic tests that we recommend is a semen analysis, in which we try and understand if a man has a good sperm count, a good sperm motility and a good sperm morphology, so that he can impregnate his wife well. Now, if at all there is a problem in the semen analysis, that is when we run additional testing. So the additional tests usually include doing hormonal tests like FSH, LH, testosterone, etc. for men, and we can also do an ultrasound of the scrotum to understand if there are any anatomical defects or any blockages that are present in the genitourinary tract. So these are some basic testings that we usually recommend. Of course, the world of testing is enormous. There are so many other tests that we can also run on couples, which usually varies case to case. So if you are someone who's been struggling to conceive for a while, I would highly urge you to go and see your gynecologist or fertility specialist who can guide you with the tests that can help you figure out why are you unable to conceive. And if you have any more questions related to this, please feel free to leave them in the comment section below. And thank you so much for sticking by till the end. I will see you again next week.